All right. Hello,
Perfect.
everyone. Hello, everyone. My name is Dr. Sharifa Yatim. I can say now doctor while I'm very happy and comfortable about it. Alhamdulillah, we're able to achieve that. Now, just really quickly and very briefly, I don't want to take too much of everyone's time. I want to quickly brief you about the ABA Journal Club. It is actually it's a CEU event that we do every 3 months. And what we do, we talk about articles, we talk about the rationale why we chose this article, then we talk about some of the summary background of this article, research questions and their goals. We'll explain to you what was their method and what was the results of their method. And then we will discuss the discussions and limitation. Then, last but not least, we will judge this article based on the 7 dimensions of ABA. And I hope everyone here today remembers the 7 dimensions of ABA. If you don't worry. We have it in the slides. So without further ado, I want to also mention that you guys can also send an email. Rowena, if you don't mind, just put it in the chat, the ABA Journal Club at gmail.com. And also, we want to make sure that if anyone that's interested to register to be member of the ABA Journal Club, so you get the next newsletter next 3 months. So make sure you send an email and you become member of our newsletter. Can we go next? All right. So we also have our Instagram account and YouTube channel. So the YouTube channel, we have it recently, we opened it. So just the session number 12 was already completed by one of other behavior analyst volunteer. The sessions from 1 to 11, it's in the Emirates College of Advanced Education website. So again, I cannot access this until I get permissions. Oh, poor people are entering now. Okay. So let me see. I think it's fine because we started late.
Yeah, yes,
I
yes,
think we
yes.
can admit all in the waiting room because there are 13 and we still didn't start. So I'm gonna admit them. This is the only
I
time
did.
this is the
Yes.
only time I'm going to accept this because it was our fault.
Okay, cool.
All righty. All righty. Now I will give the mic to Mr. Islam. Mr. Islam, please introduce yourself and go ahead with your summary of your article. And I'm gonna be
All
on
right.
mute.
Well. Thank you, Dr. Sharifa. Thank you so much for inviting me to be participated in this genuine volunteering work by Association for Behavior Analysis UAE. I'm so proud to be here today, and I hope that this discussion of the article of today will be more informative and valuable to all of our colleagues in the field of ABA. Thank you so much again, and thank you for ABA Journal Club. And let's dive quickly into the article of today. It's analysis of response allocation in individuals with multiple forms of stereotyped behavior. Actually, there is a secret behind choose this article to discuss it today in the ABA Journal Club. Um, I believe that we have now 41 of maybe families, maybe parents, maybe behavior technician or direct service providers. I believe that each one of us, Dr. Sharifa, experience at least had one experience with these behaviors with our clients in many or different settings. So today let's see what's going on in this article and what is the outcomes and how to introduce and implement this on floor with our clients. So my name is Islam Sharafuddin. I am working as a senior behavior therapist and proud to be with Dr. Sharifa in Sharifa Team Center for Rehabilitation. And also I am international behavior analyst, and I've been working as an ABA in the field of ABA for 10 years ago, and hopefully to continue like 30 years more, inshallah. So let's go through our article today. All righty. Okay, cool. So before I proceed with this article, or choose this article, I discuss with Dr. Sharifa. Dr. Sharifa asked me very important question: why? Why you choose this article? And I would like to everyone to ask you ask yourself before you go to dive into or read this article or try to implement a new intervention. Ask yourself why this article. Ask yourself what is the rationale behind this article or behind this intervention. So today, if we can say it briefly, the article provides ensure interventions are both ethical and effective in diverse clinical settings. This is the most important we have to say. Before we discuss the intervention, please ensure that it's ethical and it is effective. If it's not ethical and effective, please do not waste your time. Do not waste your client's time to do it, to invest your time in this unethical or ineffective interventions. Also, this article provides us valuable insights into the management of multiple stereotypic behaviors in individuals with developmental disabilities and autism as well. Highlights the variability in response allocation patterns among participants. Yes, we have more than we have 5 participants, different participants today in our study. The effects of response restriction in a stereotypy. Yeah, there is the effects of response restriction and stereotypy. Also combined strategies involving reinforcement and restrictions. The last one, evaluation of response allocation across multiple stereotypic behaviors, which means that we have 5 participants today in our study, and we have like 3 experiments. Let's see together. First of all, what is the stereotypic behavior? So this article, it's discussing the using the analysis, the interventions, and the response allocation with the stereotypic behavior. Stereotypic behaviors, as we mentioned, that we already dealing every day with our clients. We see it at schools and the streets and the clinical settings. So stereotypy is any or is repetitive and invariant behavior often considered to have no apparent social function. It is commonly observed in individuals with autism and developmental disabilities. So it's something repetitive, invariant, it's the same action at the same way without any variation. So the client or Islam keep doing like this, or like tapping his nose all times, same way, without any obviously or apparently social function. As you see examples like this, we have experience every day, like hand mouthing, pacing, hand flapping, body rocking, object flicking, thumb sucking, ear covering, and chin hitting. And there is more and more of the stereotypic behaviors we experience every day. For that introduction, I'm trying to be to go through these slides very quick, doctor, because we need to dive into the way of implementing and conducting this research. So in our study today, in our article today, we have 3 experiments. 3 experiments were conducted to examine how stereotypic behavior is allocated under free operant and restricted operant conditions in children with autism and developmental disabilities. The experiment number 1, when the most frequent stereotypic behavior was restricted. 3 participants showed reduced stereotypy and increased other non-target stereotypic behaviors. So in experiment 1, the most frequent stereotypic behaviors with our participants, like if we 3 participants or 5 participants in this experiment, that was restricted. It was not free. This behavior was restricted, and the result 3 participants showed reduced stereotypy and increased other non-target stereotypic behaviors. So the target stereotypy is already reduced, but on the other hand, there is another non-target stereotypic and new stereotypic behaviors already increased. And experiment 2 tested environmental enrichment. I like this term, doctor, environment enrichment, with mixed results. 1 participant shifted to appropriate object use. Another showed no change, nothing happened. And a third only shifted if the objects matched stereotypical behavior. This is in the experiment number 2, and when we will dive into in specific details all the 3 experiments. The third one, it's using both response restriction and reinforcement for object manipulation. Stereotypy decreased and object manipulation increased. these findings suggest that interventions for stereotypy require what? Careful, complex evaluation. So, how can I go through? Okay, cool. All right.
Sorry,
So,
before you go on, Mr. Islam, what is the first code? So everyone that is listening, we will tell you now the first code. Please make sure you are listening to me. The first code, Mr. Islam, is
allocation. The first code,
allocation.
allocation,
How
yes.
do we
The
spell
first
that?
Allocation.
Allocation. So
Yeah.
allocation means, what does allocation mean? So like you're putting one thing to
In
put
a
it
different,
in a different,
yes, yes,
yeah. So you're allocating something from one thing to another, basically.
yes.
So everyone,
As we see in the response allocation, doctor, that we have doing this behavior, and when we have some intervention restricted, we'll go to do another behavior or
yeah.
another action in the
So the
same way.
student has allocated his hand
Yeah,
flapping to, for example,
yeah,
body rocking. He allocated
yes,
his stereotypy behavior from there, shifted.
exactly.
Okay, so allocation is one. We just put it in a nice sentence, so make sure you write it. Please don't share it with everyone. Please don't
Yes,
share it in the
please.
chat.
Yes.
And the CEUs are only for the ones that are attending today. All right, we have around 40 people today, so alhamdulillah. All right, so I think allocation, code one, allocation, guys. Yes,
Oh,
thumbs up.
all
We can
righty.
move on. If you guys
Cool.
went for a break or anything, you missed it. So allocation, number one is allocation. Code number one, allocation. All right, please continue, Mr. Islam.
Perfect. Yeah, thank you, doctor. So as you see, guys, in the table one, it is involved with the target responses and inter-observer agreement, the IOA. So here, as you see here in the schedule, there is 5 participants called Mike, Mary, Jeff, Alice, and Greg. And the response form, we have a list of the stereotypic behavior like hand mouthing, hand biting, ear covering, pacing, page turning, pot spinning, hand flapping, object flicking, ear covering, and so on. And also here the percentage of the IOO, our inter-observer agreement, that the authors already used the inter-observer agreement in this study to see, and we have a question later on that why they are already they use the IOA. So let's see the next one. Cool. Research goal and question. This research has some questions. We hope that we will find answers for all of these questions. How does restricting a high probability stereotypy affect other behaviors? Can environmental enrichment shift response allocation or not? What is the combined effect of enrichment, restriction, and reinforcement on stereotypy and appropriate behaviors? The study aimed to analyze the response allocation among individuals with multiple forms of stereotypic behaviors, particularly how interventions like response restriction and environmental enrichment. So guys, you will hear these words too much, like response restriction, free operant, and environment enrichment, of how these response restriction and environment enrichment affect stereotypy and the relocation of behavior to alternative activities. And the research explored whether reducing one form of stereotypy affect other forms and whether appropriate behavior could emerge as the stereotypy decreases. We will see the methodology. So you have already get a brief about and a clear picture about the article and what is the topic that you are already conducting this research on it. Now we have to know what is their methodology that these authors that authors already use, general method and settings. Before we go to the methodology, that we have the operational definition that the used stereotypy was defined as behaviors occurring in boats of 3 or more. The study was conducting with how many participants, guys? 5 participants. 5 participants already involved in this article. Sessions for Mike. Here we will dive into very cool and small details that will show you, and it will be like a guide for you when you would like to repeat this article, when you would like to implement this research and outcomes in your environment in Saudi Arabia, UAE, Egypt, wherever you will have, you will see a very unclear guidelines, because they go and they went into all the small details. How did it? How did they conduct this article, this research? So sessions for Mike, Alice, and Greek were 10 minutes long and took place in room. Look into small details. So I would like you to just imagine with me what is the behind this. The sessions for Mike, Alice, and Greg were 10 minutes long and took place in a room 8 meters in 12-meter at inpatient hospital, while Jeff's sessions occurred at his school in a room 9-meter times in 12-meter bordered by tables. The general method for identifying stereotypy involved two key criteria. Number one, the behavior must repeat at least 3 times in a row. So before they already decide, Dr. Sharifa, that they will analyze and track this behavior or not, they put the standards lines for them. The behavior must repeat at least, guys, 3 times in a row, like hand flapping or body rocking, or last for at least 3 seconds without changing, vocalizing, or hand nod. Okay, the behavior must continue even when there is no social interaction or reinforcement, such as during alone or no interaction conditions. Continuing in the methodology, participant, and target behaviors. So now, guys, we will dive into the stereotypy forms behaviors for all of our participants today. We'll start with Mr. Mike. He's 8-year-old boy with autism and moderate intellectual disability, except that he has, look, count with me, guys, hand mouthing, pacing, ear covering, rapid page turning, and hand biting. This is Mr. Mike. Mary, he has 5-year-old girl with autism, and same, she has pacing, ear covering, pot spinning, hand flapping, mirror viewing with body movements, and object flicking. Mr. Jeff, 14-year-old, he has Down syndrome and severe intellectual disability, engaged in body rocking, groin rubbing, hand flapping, head rubbing, chin hitting, head hitting, snorting, tooth grinding, vocalizing, and object pounding. Alice, 10-year-old girl with a childhood dissociative disorder and severe intellectual disability, show with pacing, vocalizing, carpet rubbing, and manipulating clothes like tongue on shoelaces. The last one, Greg, 10-year-old boy with autism and moderate intellectual disability, engaged in thumb sucking, vocalizing, mirror viewing, pacing, and object pounding. So these were the behaviors of, or the forms of stereotypic behaviors with our participants today. Let's see the next one, the settings. The settings where these measurements happened. Number one, the study sessions for Mike, Alice, and Greg were conducting for 10 minutes in a room at hospital, inpatient hospital, 8-meter by 12-meter. For Jeff, sessions took place at his school in a room 9-meter and 12-meter surrounded by tables. So it's a school setting. Data for Mike, Alice, Greg, and Jeff were collected how many days? 3 to 4 days a week with 1 to 3 sessions per day. So every day, so 3 to 4 days a week, 1 to 3 sessions. The authors already collecting the data, and not only one author. There is many, there is 2 at least taking the data to go to make what, doctor? The IOA, to achieve the IOA agreement. We will discuss it later. So for Mary, data were first collected at her home and later at her school after her family relocated. She had 3 sessions per week also, with 1 30-minute sessions per day. The rooms at Mary's home, here we will describe the location or the location settings in Mary's home, family room and kitchen were 15 and 15 meter and 20 by 20 meter. Respectively, the family room contained a sofa, recliner, two tables, mirror, and an unplugged television. The kitchen also had no manipulated objects except for pot lids. Mary was free. So in this experiment, in this time, Mary was free to move between both rooms. At school, same with Mary. At school, the room was 20 meter in 20 meter with a small tables, rocking chair, and non-operational computers, plus 3 mirrors. The last 8 sessions at her school were conducted in a smaller room, 5 in 8. We already decided after reviewing this with Dr. Sharifa to mention these small details, guys, to give you how these authors already be and look into small details to show you and to show all the ABA world how they conducting this research and this study with our participants. So sessions for each participant were scheduled at the same time daily, except for Alice, whose sessions were in the late morning or early afternoon. All righty, data collection. The most important thing, data collection. How did they collect the data? Data for the study were collected through video tap sessions and what inter-observer agreement IOA was used to assess the reliability of the observations. Focus, guys. I know Dr. Sharifa will ask you later. So this is very important point. You have to highlight this one. And data for each participant were collected by directly observing their behaviors using laptops with a program that recorded the duration of each response. Each sessions was also videotaped to ensure what? Accuracy. A second independent observer either collected data at the same time as the primary observer reviewed at the videotapes later. Exact what happened in Sharifa Team Center. I'm sorry, but I have to tell them this secret. Yes, so we have already the IOA comes first, as the safety comes first with our kids. The IOA all times happened into Sharifa Team Center. So again, inter-observer agreement was measured comparing the data from both observers in 10-second intervals, 60-second intervals in a 10-minute sessions for each interval. The smaller number of observed behaviors was divided by the larger number, then multiplied by 100% to calculate the agreement percentage for that interval. The percentage were averaged across all intervals to calculate the overall agreement percentage. For Jeff, who displayed many different behaviors, two observers were assigned to record half of the behaviors each. It was like a really challenge for Mr. Jeff to calculate the data and to take the IOA. One observer recorded data for 6 behaviors and the other for 5. Inter-observer agreement was calculated for at least 25% of sessions, ranging from 25 to 48% for each behavior across all 5 participants. The mean agreement scores for each participant stereotype behaviors are shown in table 1 that we have already discussed it before. You can check it later. The experiments, 3 experiments utilized reversal designs to compare free operant conditions that we said the baseline with restricted operant and environment enrichment conditions, and we'll dive into this in the next slides. The question, why did the author use inter-observer agreement in the data collection process? We have only 1 minute, Dr. Sharifa, to check the responses in the chat, please. Why the authors was decided and implemented the IOA in this data collection process, guys? No response yet?
What I'll do, I'll send a poll, okay, a question to the chat so that they can just press on the answer.
Perfect.
So I'm gonna launch it now. All right, so we'll give you a minute. So Islam, if you want to send me the other questions, please do so in the WhatsApp, and I'm happy to put it in boards.
Sure, doctor.
So we're getting nice answers.
Oh, cool.
Please put your answers, and then we can share the answer. Can you see what is the answers coming up?
Yes, doctor. For accuracy, we have now 14 responses, 100%. Yeah.
Yalla, yalla, ya jamaa, we have 40 people online. Come on, be active. I know it's the end of the day. Yalla, we want Hamas, guys. Come on, answer the question. So you have 4 choices. Why use IOA? First, for accuracy. Choice number 2, I have no idea. Don't know. Don't ask me. By the way, you're not gonna fail or pass the CEU since you guys are here. Then we're happy. What does IOA mean? Or it's nothing to do with ABA. So choose and be very truthful with yourselves. If you feel like you have no idea what IOA, it's okay. You did not fail an ABA exam here. So it's okay. We can always explain to you. And this is why we have the ABA Journal Club. So we get to learn these ABA terminologies and scientific ones and experimental methodologies. Accuracy, integrity and accuracy, Isra. Hassan is saying to make a clear decision if that's a mistake or not. All right, to make sure the appropriate actions for the child's conditions. Diana. All right, so I think we are gonna stop the poll. We're gonna end the poll. Hassan, yes, inter-observer agreement is IOA. You're right. So yes, so basically, as Mr. Islam said, what is the answer, Mr. Islam?
To ensure that we already achieving the accuracy in these results not only depends on one person on Islam only, on Dr. Sharifa only. So we have we have 2 persons involved in the same time and the same using the same data collection to ensure that the accuracy already and the reliability of the data, and to match what is the dimension of the 7 dimensions of ABA? Or I will let you this is the question for the last part with you, Dr. Sharifa, to go through.
Exactly, Mr. Islam. Like we made sure that, like Mr. Islam made sure that this is an IOA. So any article, any research in the field of ABA, we must have 2 people in the beginning to prove that the data instrument is correct. So that is what IOA stands for. So whoever answered, I don't know. A very good thing for you to search on it. And there's different types of IOA. And I would, recommend that you guys learn about the different ones, because it could be a very good one for putting it in your clinics as well and as practitioners. Thank you. All right. So we're going to share results.
Thanks, doctor.
Thank you. You can move on.
Let's do it. Okay. All right, so now we'll dive into, guys, to the first experiment, the results and the first experiment response restriction. So as we discussed that they have already conducted 3 experiments. The first one, it's called response restriction, and let's go into what is the purpose of this experiment. That this experiment, this study aimed to determine whether restricting the most frequent stereotypic behavior would have no effect or increase the behavior or decrease other forms of stereotypy. So they are already diving into to see that would be no effect if they use the response restriction, or the increase in the BX or the target behavior, or decrease other forms of stereotypy. The participants in this experiment, it's Mike, Mary, Jeff, and Alice participated in experiment 1. Okay, the data collected were evaluated at home and at school. All right. The procedure and design that you use: initial evaluation. Each participant's stereotypy was evaluated in sessions where they were either 1, like Mike, or with another experimenter present, but no social consequences for the stereotypic behavior were provided. Session continued at least 2 consecutive sessions, showed a constant pattern of the most frequent stereotypic behaviors, or until 300 minutes of total sessions time had passed. Sessions lasted 10 minutes for all participants except Mary, whose sessions were 30 minutes. Identifying the most probable stereotypic behavior was determined by examining the trends in data across individual sessions, or by analyzing the overall average time spent on each behavior. This process identified the most frequent behavior for each participant. The design that they used reversal design. A reversal design was used where I represented the baseline, which the free operant condition, and the B presented the experimental, its restricted operant condition. The first most probable behavior was designed as indicated, like mentioned here, as R1. The second most probable behavior as R2, and so on. Let's see. Okay, cool. The baseline, a free operant condition. In this phase, participants were either alone or with no social interaction. No one interact with them. They have already the 100% free to engage in the stereotypic behavior, and no consequences were provided for the stereotypic behaviors. So they make the hand flapping or the hand pacing, whatever the behavior that they did, no any consequence, no any interaction from the observers. So restriction condition, once the most probable stereotypic behavior was identified, it was restricted. Here, the opposite of the free operant. The free operant, they are already free to engage in these behaviors. Here in the restriction condition, the opposite, that once this behavior happened or identified, that it was restricted in the experimental condition. All right. Let's see how did they restrict and prevent this behavior. Mary pot spinning was her most probable behavior, and it was restricted by removing what? The pot lid from the room. She's trying to make the pot spinning, and to restrict this behavior or to stop this behavior, guys, what did they do? They do that they already removed the pot lid from the room. For Mike, pacing, going forth and back. Pacing was Mike's most probable behavior. It was restricted using a mild verbal reprimand. No pacing, Mike, please sit in the chair. No pacing, no pacing, Mike, please sit in the chair. A stimulus card was placed in Mike's view to signal when pacing should stop. After several sessions, the card alone was enough to prevent pacing. So this is the way how to stop the behavior for Mike. For Alice, pacing was Alice's most probable behavior. Same Mr. Mike. A therapist sat close to Alice and blocked her from standing. So the behavior therapist was sitting behind Alice and preventing her or blocked her from standing to stand up. Verbal prompts, stay in your chair, Alice, were used to restrict pacing, though Alice could still reach the carpet. Jeff, hand rubbing was Jeff's most probable behavior. A therapist stood near Jeff and gently separated his hands whenever they made contact. So each time Mr. Jeff make hand rubbing, the therapist gently separated his hands whenever they made contact up to the elbows to restrict hand rubbing. So this is the way, guys, how the observers and the therapist stop or restrict the behavior. This procedure allowed researchers to observe the effects of restricting the most probable stereotypic behavior on the other forms of stereotypy each participant displayed. Why? Because this is the experiment one, it's response restriction.
So we just have 20 more minutes. Can we just fly through if you can? Thank you.
Sure, man. Sure, doctor. Yeah, I will go through only the experiment one, and we'll see. We'll let the attendants to read and check the other experiments in the PDF, and we can send it to them. For response restrictions, Mike free operant phase, as you see, guys, we will go through what happened and what is the results. The free operant phase, as you see here mentioned on the graph, Mike allocated the most time pacing, 60 3% and hand mouthing 51. Other behaviors like ear covering and hand flapping occurred less frequently. However, so as you see it, it's already mentioned the hand mouthing, that diamond shape, the pacing, the square shape, and the page turning here is that triangle, the black triangle. R1 it faced restriction of pacing. When pacing was restricted, Mike's pacing dropped to 5% and mousing decreased to 14. However, the behavior of page turning increased to 21%. Second, again, stop the intervention, make baseline again after returning to the baseline or the free operant phase. Free operant phase, there is no intervention, guys. There is no consequences. There is no any engagement with the or consequences for the behavior. The pacing was 58% and hand mouthing 45% increased. Oh my God, increase, and page turning grows to 21%. Second, R1 phase, again, make the restriction, the intervention. Now restricting pacing again led to decrease in pacing, 0%, and hand mousing 9%. But page turning significantly increased to 44. Please, guys, focus. You will see some behaviors already extinguished or decreased, and some other behaviors maybe go in increased. Third phase, free operant phase, also pacing 96% without any intervention concerns, and hand mouthing 74% returned to high levels while page turning decreased. The third intervention phase, restricting pacing again reduced pacing 1.6% and hand mouthing 20%, but led to increase in what? In page turning like 37%.
Is that, sorry, I wanted to say, is that what you mean when you say allocation? Because I feel like if you go back, like you see
yes,
how it increased the
yes,
other
yeah,
multiple stereotypy behavior, right? So this is so
yes.
important, guys. As practitioners, when we're working and we want to put interventions for stereotypy behavior, you need to understand that if you try to stop one behavior, then another stereotypy behavior will increase. And just side note, disclaimer, we use compassionate when we are thinking about whether or not to change stereotypy behaviors. So this is something ethically we need to do in the back end before putting in place any interventions regarding stereotypy behaviors, and there's factors for us to do that. So yes, thank you so much, Mr. Islam. Keep going.
Sure. That's habit also with Mary and the Jeffs as well. The key findings, let's go to the key findings. The behavior shifts with restriction for three participants, Mike, Mary, and Jeff. Restricting the most frequent stereotypic doctor decreased that behavior and increased less common response like page turning and body rocking. This suggested that restricting, as Dr. Sharifa mentioned right now, did suggest that restricting one stereotype can promote alternative behaviors. Again, the key findings of this experiment, like individual differences, guys, please ensure and put that in your in front of your in your mind. Individual differences. Alice showed little change in her behaviors when her most frequent stereotype was restricted, highlighted individual variability in response to such interventions. That's why we have to keep our intervention is very unique and very individually, not copy paste the interventions. Implications for practice. These findings support using restriction to reduce frequent stereotypes and encourage alternative behaviors. However, individual differences should be considered when designing interventions, please. Experiment 2, well, you can read it later. I know that we don't have enough time to give the mic control to Dr. Sharifa. General discussions, if I can get only 1 minute more, doctor, for the
You're
yes,
okay. You're okay.
yeah,
You,
for
you
the
can continue.
cool for the general
Because people are also interested, sorry, that they want to also learn about the replacement behavior.
yeah,
So, how about replacement behavior? So, they want to hear about this. And if you want to stay for another 5 minutes or 10 minutes after 6 o'clock p.m. UAE time, after our session, then we're happy to go through the 7 dimensions of ABA as well. So, Mr. Islam, do take your time. I feel like people are more interested to know about your study rather than going to the 7 dimensions, which we can take less than 5 minutes for it.
perfect. Okay, thank you, doctor. Thanks so much. So, guys, we will dive into the outcomes of this study to just get some insights and information. But before we go through, shall we now tell the second word, doctor, or
Yes, we can. So the second code is, Mr. Islam?
Enrichment.
Enrichment.
Yeah.
Those are big words, Mr. Islam. You chose like difficult ones, right? So
To just ensure that the guys already have visual focus, and they already focus, because we have already mentioned these words before:
yes,
allocation and enrichment. Yeah.
good one. For free, you guys need to focus more. So
Yeah.
code number two is enrichment. So enriching the environment. We want to make it as much as possible enriching for the child to be able to mend and tact and interverbal. So enriching the environment is an antecedent intervention. So حاسه انا قاعده اسوي دعايه. I feel like I'm making an advertisement about enrichment. So
Yeah.
yes, enrichment environment, guys. Okay, so enrichment is the second code. Enrichment. Enrichment. Enrichment.
Perfect.
Well done. Like an antecedent intervention in ABA. Well done, Mayada. All right. Keep going, Mr. Islam.
Cool. Yeah. So now, in the general discussion, the results from experiment one, guys, revealed that individual displaying multiple forms of stereotypy often had a specific response that was most probable under the free operant conditions. When the most probable stereotypic was restricted, the three general patterns of behavior allocation emerged. Number one, reduction of untargeted responses. Untargeted responses, like restricting the most probable response, maybe lead to a decrease in non-targeted behavior. Restriction of pacing in Mike. What happened with Mike? The restriction of the high probable behavior or stereotypic behavior pacing, it's reduced hand mouthing, which hand mouthing was untargeted behavior. Number two, increase in less probable responses. Restriction of the most probable response led to an increase in a previously less probable behavior, like restriction of pot spinning in Mary increased the mirror viewing. The number three, no change. Nothing happened. In some cases, restricting the most probable response did not significantly alter the allocation of time to other behaviors. Alice's pacing restriction did not produce consistent any changes. So additionally, as Dr. Sharifa mentioned, that environmental enrichment was tested with mixed results for allies. It increased manipulation of objects and reduced stereotypy. However, for Jeff, environment enrichment had no impact on his behavior. For Greg, enrichment with specific items, sketch toy or music, reduced stereotypical responses linked to similar sensory inputs like visual stimulation for mirror viewing. The study also explored interventions to increase object manipulation for allies. For allies, restriction of pacing increased object manipulation beyond levels observed with environmental enrichment. For Jeff, reinforcement for toy manipulation increased time spent on the toy and decreased stereotypical behaviors. Behavioral relocation interventions designed to reduce stereotypy can lead to what? Change in other behaviors, which could be desirable or undesirable. So just please, guys, before you design or before you implement or in the process of tracking or evaluating your intervention, keep tracking this. Maybe you will get desirable results or consequences or undesirable consequences when you provide and implement your intervention. Matching enrichment to sensory functions. When you match the enrichment and the environmental enrichment to sensory functions, enrichment may be most effective when the stimuli match the sensory outputs of the targeted stereotypic. What does it mean, guys? So when you have to replace, as we Mayada said, replace the behavior, and you will go to give him the sketchy toy or the massage sensory, whatever this is, it functional or not? It will give him the same function or the same needs or not? So put in your mind, do not, okay, I found this massage toy in Amazon and has like discount 50%, I will buy it with no reason, with no function. So keep that you use the right and the more functional massage toy or the sensory toy to be as an effective replacement way or intervention. Stereotypy after removing restriction procedures may lead to increase in stereotypy, highlighting the importance of managing post-intervention effects. The last slide, before we go to Dr. Sharifa, limitation and future research, we hope that we find one of our attendants today to make the next research in the same topic. The generalizability of the results may be limited by session duration and the specific behaviors targeted as well. The findings may not apply to individuals with fewer responses forms or different treatment protocols if you use different treatment protocols. Future research should explore, guys, the effects of restricting less probable behaviors and examine whether prolonged access to stereotypy during environmental enrichments leads to long-term reductions or a return to previous levels of stereotypy. Additionally, strategies should be developed to either prolong the effectiveness or enriching stimuli or rapidly decrease the reinforcing value of stereotypy to promote appropriate behavior. This is the question that we have to ask ourselves, and we have to find answers for these questions once we dive into. And you guys, I really highly recommend you to read this article, and we can ask Dr. Sharifa and Ms. Ruwaina to send you all the attendees the PDF copy to enlighten yourself and get more insights about that. The other experience, we already discussed the experiment one. We still have two other experiments. So the discussion questions, you have to see what the factor influence whether environment enrichment reduces stereotypic effectively. Why might restricting one stereotype leads to increase in others for certain individuals? How can interventions be personalized to account for sensory preferences? Where should researchers focus next to better understand the interaction between multiple forms of stereotypy? When is the reinforcement most be beneficial in promoting alternative behaviors over stereotypy? When you read the article and analyze this article, and you can find the answer for these questions, all times ask yourself why I have to read this article, why I have to implement this intervention before you just copy paste and go ahead. So if you will can and how you will implement that on floor with your clients. I think the slides comes very, very late. So now we will go to Dr. Sharifa to be on floor discussing you if we have time. Thank you,
Yes.
Dr. Sharifa, again for giving me this chance. It's my first time to present in English to these people, so I hope that I already added any information, and so excited to the next ABA Journal Club presentation, inshallah. Thank you so much. Thank you, guys.
Thank you, Mr. Islam. That was very enlightening. And unfortunately, because of the time, it's very, very tight. This article is huge. It has 3 different experiments, right? So it's never, we're going to finish it in 1 hour at all.
Yeah.
So please do take your time to review the article to read more about experiment 2 and 3. I would highly recommend it. It will give you a better understanding of why and how to whether it's something that you want to change as a stereotypic behavior or not. So again, be very careful when we do put any programs for stereotypic behaviors. So let's jump into the 7 dimensions of ABA. So all ABAers or technicians, analysts, assistant analysts, we all know we have to be memorizing this like it's as if we know our names. There are 7 dimensions, and the easiest way for you guys to memorize it is get a cab. That's why we have a picture of a cab, like a taxi. In the US, they say cab. In UAE, we say taxi. I don't know about you guys, wherever countries that you guys come from. Do you say taxi or cab? I don't know. But get a cab stands for G, generality, then A, effectiveness, T, technological, A, applied, C, conceptual, systematic, A, analytical, and B, behavioral. Ala, yes, Florida University, I salute them with this amazing research. I enjoyed it. Going next. So do you think that this article met generality as one of the 7 dimensions of ABA? Mr. Islam, can you go next? So as we know, generality, back to generality. As we know, generality is when we say that the article showed that they tested with different possible environments, with different participants, with different variety of behaviors. Did they do that? Do you guys think they did that? Yes or no? Can we put it in the chat? We can give them scores. So what you usually do in the ABA Journal Club, we will give a score out of 7. So would you give a 1 or a 0 for generality? What do you guys think? I can see people here sending me messages for everyone in the meeting. Yeah, I can see people sending me messages. Mostly they're saying yes. They see that they have done their due diligence to do the generality. Okay, next. Effectiveness. What does that mean? Is the intervention effective when they improve a particular behavior that we want to change? If the application of the behavior techniques does not produce large enough impact or value, then the application has failed. So based on Beer, Wolf, and Risley, they are the ones that put together 7 dimensions of ABA, and this is now widely known in all exams. Is it effective? Do you feel that this article showed that they are different, let's say, effectiveness of their intervention on stereotypic behavior? Was it effective, or do you feel it made things worse? So this is what you ask yourself with all of your interventions. You know, it's not just when you're reading an article. Even when you're creating an intervention, you got to ask yourself this: Am I meeting effectiveness of this intervention? What do you guys think? Do they meet effectiveness? I can see people are saying some are saying yes, but not really. Some are saying yes, but some of them saying we need some more. We need to read more. But I think when I read this with Mr. Islam, we thought that yeah, they did show that some interventions were effective and some interventions were not. So they did answer our question. So we gave them a score. Technological. So what does that mean? Technological is not about technology. It's not about like computers. People always think that way. Procedures are described clearly. When we say technological, it means you write it very clear that you're able to implement the procedure accurately and all the steps were written in that article. Are you able to pick this up and say like, okay, let us try to convert this into an intervention program for one of my clients? Yes. So you see, when you answer that question, that means you met technological for your intervention. All right. Now, going next, we have only 5 more minutes, guys, and now I'll give you the last code, and then you guys can go do your things in a bit. Applied means we are looking into behaviors that you can improve socially. So behavior change is applied when it enhances and improves the everyday life of the learner and those who are closest to them. But I don't know, Mr. Islam, if you came across whether the reason why they choose stereotypic behavior was it something that it's having an impact on their learning or having impact to their family or their environment. So I'm not sure about that. I didn't see justifications around this. Yes?
Yes, same, yeah. They
Okay.
didn't go into the same reason that they go into why they already making the analysis of these stereotypic behaviors, but they didn't mention that the reason that this behavior was really a barrier in the learning or happening
Yeah.
at home or whatever. Yeah.
Yeah. So we have some research that are using blocking for the stereotypic behavior, but now they wanted to show that blocking could increase other multiple stereotypic behaviors. So it's not always the best way to go forward for it. Conceptual systematic is when interventions are consistent with the principles of literature and the research. And it is important that practitioners continue to use, of course, the research-based techniques, such as now what we're talking about, such as blocking, environmental enrichments, and avoid using any shortcuts in our teaching methods because shortcuts do have a negative impact on the client's progress. So do you think that they use conceptual systematic ABA interventions? Yes? No? What do you guys think? Are they basing their interventions based on the literature and other research? What do you guys think? All right, so I'm getting some answers. privately, please do answer them in public عشان نشجع الناس. And we'd like to get people more involved and be more responsive. It's good for you guys. Yes, conceptual systematic, and they're basing on the principle of behavior analysis. And great. Okay. Analytical. Thank you, Dr. Najwan and Isra, for being active with us. It gives us a positive reinforcement, guys, so we can do this more. Okay, analytical. Is it analytical? Can you show that the behaviors were produced, the behavior is shown that whenever applies a certain variable, the behavior is produced or removed? Yes. So they got 1 point for that. Behavioral. Is it behavioral? Was it observable? Were they able to measure? Were they able to use a measurable proof for improvement? Yes, yes, yes. So, my God, this article scores 7 out of 7. Well done, University of Florida. I hope someone sees us so that we can tell them that we judged their article, and we're very happy. As practitioners in the field, we are very proud to be using evidence-based practices. That's why I love ABA. So, full score. Well done. And last but not least, I would like to thank everyone. And the last code is Mr. Islam. You got the mic. We can't hear you.
Yeah,
Yeah.
yeah, Coco. The last word is SYCR. SYCR.
SYCR. Okay, dokie. SYCR. Anyone that knows what it stands for gets an extra gift.
Yes.
SYCR. It's an abbreviation.
Yeah.
SYCR. Abbreviation for SYCR. Okay, so that's code number 3. All right, let's go next. I think that is a wrap up, right, Mr. Islam?
Yes, doctor. Yeah.
Okay, so thank you so much again. This is our email. I've sent a links, like a lots of links, so that you guys can get the article. You guys can please follow us on YouTube, on Instagram. We're trying our best to be better. I promise you. And inshallah, this is all volunteer based. We're not paid to do this, so we appreciate your support in attending this, telling your friends, being part of this ABA Journal Club, and we promise we will do more as much as possible to build a better clientele in the region of the UAE and around our region of the Middle East and Asia. Thank you, everyone, and have a wonderful day.
Thank you. Bye bye.
Bye, everyone.